Hi, everyone. Happy Monday. My name is Taylin Washington Harmon, and I am the clinical trials editor here at blackdoctor.org. And this is the first of one of our clinical trials and Black folks related shows that we haven't had in a while. And I'm really excited to, my apologies. And I'm really excited to bring on a really important guest of ours who has participated in a clinical trial and has a chronic autoimmune disease. Her name is Tasha White, and I interviewed her some months ago, and I'm really happy to bring her onto the show today. Hi, Tasha.
Hi, how are you?
I'm great. And yourself?
I'm doing well, keeping cool.
Good. Yeah. It's really hot out here. It's really hot out here. So I had just introduced you, as a colleague of mine. You've done some amazing work with Myasthenia Gravis and working with other people who have your rare condition. So please just introduce yourself and just tell us a little bit about what your condition is.
My name is Tasha White, and I have a nonprofit called My Walk with MG. I have myasthenia gravis, which is an autoimmune disease that targets the immune system and breaks down the communication between the nerves and the muscles in the body,
Mm.
causing mild to severe fatigue. I've lived with myasthenia gravis since age 6, and I will be 38 next week.
Wow, congratulations.
Thank
Congratulations. So I guess first off, describe having myasthenia gravis to someone who may has never encountered this illness before, because even before I met you, I didn't know what myasthenia gravis was. So I guess how can you describe it in the simplest terms?
I like to use visuals. A friend of mine actually asked me about it, and I have this weighted blanket. Well, I had a weighted blanket, and I like literally saturated it with water. So I told my friend to lay on the ground or on the floor, and I put the blanket on top of them, and I said, "Okay, now try to move and get up." It was if you've ever used a weighted blanket, you know that the heaviness from the blanket, prevents you from moving. But just imagine that it's completely wet with water, and it makes it even harder. So that's how I actually describe MG.
Wow, that's really tough. So basically, is it like, can you imagine walking with a wet weighted blanket on your body? Like when you're,
Yes, it's
yeah.
like you're struggling. You literally are struggling. Your muscles are overworked, and you don't have to honestly really be doing anything. You could, like now, you and I are talking, and honestly, in the next 5 minutes, my speech could slur, or I can get a severe migraine, facial, the facial paralysis or droopiness. You could I mean, and which leads to or could lead to a possible medical crisis and having to call 911. That's how unpredictable and fast it is.
So how can you usually tell when this is coming on, like about to happen?
So I don't really experience like the textbook symptoms, um, which are fatigue in the body, weakness of the limbs. Slurred speech is one of those things that I'm fairly new to, but my mom and my son are very, very attentive to when my symptoms come, and they can just look at me and say, you know what, go lay down. But I get like this real heaviness, like up under my chin, and my lips and my tongue start tingling. So that's when I know when it's active.
That's really tough. So I see that myasthenia gravis maybe affects maybe 10 to 14 people out of 100,000. So it's extremely rare. So how did your family first discover that you had this?
So my mom, being the average 6-year-old, you're supposed to be jumping off the furniture, running around, and things like that. But she always told me that it was something a little different because I would go lay down, or I was always still. But this one particular time, I do remember I was outside, I was playing with the neighborhood kids, and my body just completely just went limp, and I went to the ground. So I had to pull myself up using a stop sign and a fire hydrant that I was playing around. So after that, that's when I guess that kind of triggered something in my mom because she immediately got me looked at. And I was probably one of the very few lucky ones that got a rapid diagnosis.
Hmm. And does in this condition doesn't run in your family, does it?
Well, technically, they say it's not hereditary, but my aunt, who actually just passed away in January, she had it as well. So,
Awesome.
um, thank you, learning about it, outside of doctors and things like that, I had my own personal inside man, to teach me about myasthenia gravis and things like that. So I actually got to watch her and what it can actually do to someone who has it.
So basically, just seeing how she dealt with the illness kind of informed you, how to care for yourself and treat yourself in that way, right?
Absolutely. And although my diagnosis came really early, she was diagnosed when she was 18. I had the thymectomy. I don't believe she did. So
Mm,
I think that kind of benefited me throughout my life growing up because I didn't, I ended up going into remission. So I didn't have any meds or anything like that from 93 to 2015. So I had never really dealt with anything. I didn't know that I mean, I knew about triggers, but I didn't know what would trigger me. So those
mm.
are the things that she taught me throughout my life.
So, for those who don't know what a thymectomy is and how that relates to MG, that's the shorter acronym for myasthenia gravis. What exactly is a thymectomy?
So a thymectomy is the removal of the thymus gland, which they believe that it participates with um, decreasing the amount of antibodies that are produced in the body.
Hmm. Hmm. So, basically, by removing this thymus gland, you said you're reducing the number of antibodies. So, how do the antibodies react to MG?
So it's one of those things where the body, you have these, the good and the bad, but the body just attacks both good and bad. So
Hmm.
it's like your basically your entire body is confused. So it
Hmm.
doesn't know if this is a good antibody that will help you recover from what the common cold or some sort of infection. It literally just attacks anything that in the body.
Hmm. Hmm. Okay, that makes more sense to kind of explain how that goes. So you mentioned triggers. What were some of your aunt's triggers, and have you discovered what your own triggers were?
So I one of the most common triggers is heat. Summertime, living in the Midwest is really unpredictable because we have some very, very crazy weather. But heat, stress, even being frustrated, those are my triggers. I do know that heat was one of hers. Everything else, I'm not sure. Not living in the house with her, but a common cold is a trigger. But what knocked me down was heat, and I was stressed.
Mm-hmm. So after you had your thymectomy, you mentioned that you went into remission. What exactly is remission from MG?
So remission is for me. It's one is a medical remission, and then it's the remission that I was actually in, where I didn't have to take any medication to treat the MG. So basically, my MG was under control. So
Hmm.
I was able to, function a little bit normally throughout the day, going to school, being a kid and things like that. So that remission is what I was in. No med free, actually.
Hmm. And you would say that your quality of life definitely improved from that?
Oh, absolutely. And it's even, coming out of remission, um, I still benefit from having a thymectomy.
Mhm. So tell us about how you ended up coming out of remission, because I know just hearing like leaving remission is often a very scary thing for people with any type of illness. So what was it like coming out of remission for MG?
So the situation that I was in, I was dealing with a business matter, and I was completely frustrated.
Mm,
So September rolls around, and our weather was transitioning from summer leading into fall, but it was still hot outside. But again, I never dealt with the heat as being my trigger. So I think that situation that I was dealing with, it my body just went bananas.
mhm,
Um, I had never experienced slurred speech, so that was happening. I had the most excruciating headache, and as far as body weakness, the only thing that I experienced was my fingers being a little weak. My
mhm,
son at the time, he was a little guy. He asked me for a cup of water, um, and I got the cup, got the water, but the cup had hit the floor, but my hand was still in the position like I was holding the cup. So um, my
So you
breathing, trying to take a
frozen.
deep breath, that was hard. So I
Mhm,
said, you know what? Maybe I just need to go to the hospital.
mhm.
Um, and that that was one of the most traumatic experiences of my life.
I'm so sorry.
Thank you.
So after realizing that, that your condition had essentially returned, what were some of the next steps that you took?
So I went to the one of the local emergency rooms, and they got me checked in. I was letting them know what was going on. Also, let them know what I had. They asked, was I on any medications? I told them no, but I always kept methadone. That was one of the meds in the house, just for emergency purposes.
Mhm,
So they got me checked in, went to the back, getting hooked up, talking, speaking with the nurse while she's getting me together. She told me at that time it's 2015. In her 25 plus years, I was the second person that she ever encountered with MG. So we were talking, and it was a little rough because, again, I had slurred speech, but I had to fight for proper care because the ER doctor on call that day was trying to give me a medication that I could not have. So we
mhm,
have like this cautionary list of meds. I call it our blackout list of meds. And he kept saying, well, she's presenting signs of stroke and things like that. So I'm screaming through slurred speech, trying to explain. Um, and when I literally had to tell the doctor to shut up, just be quiet. No disrespect, but shut up. So
mhm.
yeah, that was really hard for me.
Yeah, and I mean, it's a pretty common experience for Black folks often in the medical community. Like we feel as if we constantly have to fight for proper care and
Mhm.
fight to even show that we have agency over our own bodies and often know our illness better than a doctor who may have just seen us for the first time, especially, in these emergency situations. So that kind of leads us into clinical trials. So Black Americans make up roughly 5% of clinical trial participants of any kind.
Mhm.
And, I talked to you before about your clinical trial experience. So tell me, how did you learn about a clinical trial for myasthenia gravis?
So one of the doctors that the neuromuscular specialist that I had before I had my son, who is by far one of the best in the country. And I was very fortunate to have him. We always spoke about it, but this one particular visit when I came in, just for my regular checkup, he asked me, um, would I be interested? And I said, well, what would I have to do? So this particular clinical trial was for me to give blood, and they wanted to basically track how I, go about day to day with MG, and I was still in remission as well. So, yeah, I didn't have a problem. So over a course of a couple years, every time I went in, they drew blood. I guess they wanted to see how active the antibodies were, or that those that presented itself, while me being in remission and being med free. So they so yeah, I didn't hesitate at all when he
See,
asked.
that's amazing. That's amazing. And I think one of the best parts about clinical trials is that we can learn so much from people, particularly like you, Tasha. You're kind of like a medical anomaly in a way. Like you were in remission from this really chronic condition that not too many people have. And because you were able to participate in this trial, you've sort of paved the way for others who have this condition. So I'm really glad that you were able to do that.
Thank you.
So have you heard about any other like trials for MG since then?
I have, and I shared that information as best as I can, well, as I get it in, um, particularly for people like myself. We all experience everything differently. And I definitely do believe each disease out here, and it's way too many to count, that it affects different races differently. Um, I don't know how, if anybody ever really thought about that, but it does. I don't know if most are scared of clinical trials, or if they feel like it may excuse me, they have to do some different things or add more medications. Most of them aren't medication based, and I think outside of those, I think those will be the ones that I would really encourage everybody to try. The only way for medicine to continue to advance is because of the clinical trials, which is how we have all of these different types of treatments. One drug treats multiple autoimmune diseases. So, um, participation in clinical trials, especially in the African American community, is very, very important. I think the statistics for survival rates could possibly go up, especially if outside of mine, like breast cancer and things like that. That one definitely, So I would really encourage everybody to just think about it, and just get the statistics, get the information, and try it out. You like you said, you told me, I paved the way for the next person. They could be doing the same thing.
Yes, exactly. And you're so right about how certain illnesses and conditions can affect Black people very differently. I actually had a conversation with a cardiologist about a long time study that was going on about the differences in treating cardiovascular diseases in Black men versus white men. And it looked like
Hmm.
Black men were responding differently to different drugs. And because, clinical trials, there's not a lot of diversity. And now the FDA is trying to enforce that a little bit more, you know, that was suddenly a breakthrough, seeing like, okay, once we actually study Black Americans, study Black people, and study how our conditions affect us, we can potentially stop dying prematurely of these diseases or potentially be diagnosed sooner with these diseases so that it doesn't have to be a death sentence or waiting forever for treatment.
Absolutely, and I agree with that. My dad actually had heart disease.
Mm,
So that was what he succumbed to.
mm.
But I really do think that all just one question I do want to ask, what is stopping anybody from trying to do a clinical trial?
Well, a lot of our surveys and just research has been showing is that, just a history of medical mistrust and distrust among Black Americans. And I mean, it's fairly warranted. A lot of modern gynecological information and studies that we know came from, being Black women who were enslaved in the past. A
Mm-hmm.
lot of that comes from them. And then, in the mid 1900s, there was the Tuskegee syphilis experiment where they were basically withholding treatment from Black men who had syphilis to see how it affected them, and they didn't treat them to their knowledge. So a lot of that fear stems from that. And then, of course, we had the COVID-19 pandemic where a lot of misinformation was, flying about.
Mm-hmm.
And even though Black Americans were dying at such a high rate from COVID, a lot of us still did not want to be vaccinated or seek any prevention methods for the illness. So there's just a lot of medical mistrust or distrust, among Black Americans. And even, talking about your experience, how a doctor didn't want to listen to you and thought that you were having a stroke when you knew your illness. Like, there's just a lot of fear around doctors mistreating us. And the good thing is, like I said, the FDA is pushing for more diversity guidelines when it comes to clinical trials. There's more laws and just testing in place to make sure that people of different, backgrounds, minorities, et cetera, are being treated the same in these trials. There's actually a really great study that just came out last week about how minorities are basically being treated the same as white Americans in the majority of these clinical trials. So the work is being done and a lot of the fears are being dispelled. But of course, it took time and it took energy for us to even get to this area. So that's definitely one of the reasons that I know people, particularly Black Americans,
Mm-hmm.
are worried about clinical trials.
Definitely. I definitely agree with that. And I'm just glad that we are having this conversation and using this platform. Because even with all of that history and, we, what can we pull from that and learn from it to where we can use it right now, to where
Right.
we can, be heard and being, can we sit at the table with the doctors and things like that so they can get a better understanding? A lot of people miss all of that information, and I will never, downplay a medical professional, with the things that they learn going to school. But honestly, the people living with these illnesses are the experts. I had to tell the doctor that, so after a little bout and I had to call my mom, we were able to get everything, together and get me treated properly. And he listened.
Yes, that's really great. Yeah, it's really just finding, culturally competent doctors. And in a lot of cases, I mean, having a Black doctor in general can be very helpful. I mean, the studies show that Black Americans do feel more comfortable going to doctors who are the same race as them. So often that can help, dispel some of the fears like, okay, this person must have my best interest at heart because they look like me. So that's another concern. And that's part of the reason why blackdoctor.org exists in the first place, is to be able to connect people who look like us with medical professionals who can provide some of that assurance and make sure that, we're getting the treatment that we need. And
That's
also
great.
to
And
help, doctors who aren't Black understand what are the issues that Black Americans are looking at when it comes to our health and how
Mhm.
can they be of better service to us.
Yes, I am very vocal about that. I've actually I think during one of the first three times I was in the hospital, I was able to speak to a group of medical students, and the doctors. They were just asking me different questions, and the doctor asked me, say, hey, I have students come in, and one of the craziest things is it's not a lot of information taught on rare diseases and myasthenia gravis while they're in school, which is really crazy,
Mhm.
because I have my massage therapy license, and it was a whole segment of myasthenia gravis, and that program was just a year old. I mean, a year long. So just that, like comparing both of those different fields, I it was really mind boggling. But I was very I appreciate the doctor asking me, and I was grateful to speak with them. I mean, they were asking so many questions. So being able to have that type of communication, those conversations, I don't know how I could do it, but I want that. I really do want that, and we need that.
Yes, that is so good. And I'm glad that those medical students that you spoke with were that inquisitive, because what a lot of people don't understand about the medical field is that things are constantly evolving. It is a research based field. And the only way that you can get proper research is by asking questions. The right
Absolutely.
questions can become studies. You might have inspired a study on myasthenia gravis just from talking to those students. So it's just keeping those lines of communication open.
Yes.
So I do want to ask you a bit more about your organization, My Walk with MG. How did that come about?
That actually came about from the very first time going to the emergency room.
Mhm.
So when I got home, I was in the hospital maybe 5.5 days receiving a new treatment that I don't take anymore. But I got home, um, got myself together, and just sat there and I cried a little bit. And my mom she said, what's wrong? She thought, I was in pain or something. I was like, Mama, just the fact that I had to fight and argue with someone who's supposed to listen to me, ask me what's going on, how long I've been, feeling like this, and things like that. I was like, Mom, I had to tell a whole adult to shut up, which I don't like to do. And, I'm very respectful. So her and I talked, and I said, I know I'm not the only person that has went through anything like this, no matter what was going on with them. So I started researching nonprofits, just not specifically nonprofits, but just researching on how I can just go about getting the word out, and that's when a nonprofit came about.
Mm.
Um, and it took me 2.5 years to get that information that I needed on how to start it. I ended up going back to school. So in between 2015 and 2019, when I went public, I was battling in and out of the hospital, and this time 10 to 11 days at a time,
Mm.
because we were trying to one, I had to find a new specialist, and then two, I had to figure out how I can get back to my baseline.
Mhm.
So that was a struggle. But from my hospital bed, I'm building this nonprofit, and I'm back in college. So because I wanted to use the information from college on how to create this facility type organization, so I can help those like myself. Um, and it went from there. And when I went public, and I've had, my family knew I had it, but I had friends from kindergarten, first grade that had no clue. And it wasn't that I was hiding it, but at that time I had already had my thymectomy. I was already in remission, and I'm running and climbing trees just like them. So, um, yeah, and at that time I didn't know how to say it. So it's like a mood killer, we're kids. They like, well, what is it? Well, I don't know, so the my support system is phenomenal. Even the new supporters are phenomenal. Um, and just the nonprofit is not like we have a national organization, but it's not like that. Mine is from a point of view from, because I'm able to explain, because I was a child with it, and now I transitioned to an adult, so I can do. It's like the best of both worlds. So it's more so on the supportive side. What can the world help us with, and what can we give to the world to better help us? It's not just targeted to people with myasthenia gravis, but it's friends, it's family, because it affects everybody. If you love me, it will affect you.
Right. Exactly. So tell me a bit more about some of the activities that your nonprofit engages in.
So we do. I have this segment called 30 Faces of MG that we do during June. June is our awareness month, and I put the information out, and what we look for is your best picture of you living your best life. A few interview questions, but what is one thing that you live that pushes you every day to get up and do what you want to do? So
Mm.
we showcase from little kids, babies, toddlers, on up all the way up to however big age you are, because MG does not affect it knows no race, it knows no color, it knows no gender. So we show everybody those stories that we post, that we share. The comments are just crazy out of control because somebody will say, you know what, I went through this,
Mm.
your story is helping me, thank you for sharing this. Just I did a I think June 22nd we did our second part to an informational event. COVID shut us down to do this one, but I was able to pull in a mental care therapist, someone who's a health advocate, another health advocate, and we just talked about the importance of therapy, dealing with chronic illness, um, better ways to structure our daily lives and things like that. And now we're currently in the middle of our third back to school, where we send school supplies to children with myasthenia gravis, just to let them know, the as adults, you hear everything about them, but I really want to let the babies know you are not lost in the sauce. We got you too.
That's good. That's so good.
Thank you.
Um, has your organization kind of helped people uncover that they have myasthenia gravis because it's so rare?
So from some of the stories, we get comments where, they say, I've been experiencing this. I don't have a diagnosis. Now, we aren't able to diagnose anybody, but
Right.
that's our disclaimer. We don't want anybody to say, well, you know, them over in my, no, we want, if you having those symptoms, and I get those messages, have you, my advice is write down what you're dealing with and then present it to your, um, first your PCP, because your PCP will, was supposed, is supposed to move around and take that information to find you the help that you need if they can't help you. So
Right.
some people, I'm not sure if they got diagnosed after, reading some of the information, but it's a lot of newcomers that have recently been diagnosed with MG.
Good. I see. So you mentioned that when you hear about new MG clinical trials, you try to share them. Like, where exactly do you share that information?
Oh, I share it on our Facebook page. We're on Instagram. I'm getting savvy with TikTok. So anywhere that I can share it, I share it. And I usually get it from like our national organization. And oh no, what you
Uh-oh. Everything okay? Uh-oh. We may have lost Tasha. Give her a moment to get back. Okay, I'm so sorry, everyone. It looks like we've had some technical difficulties with Tasha, but I will share how you can reach Tasha if you have any questions about myasthenia gravis, and basically how you can get involved in some of her efforts. as far as getting research for myasthenia gravis, understanding myasthenia gravis clinical trials, and things of the sort. You can find her on the internet at My Walk with MG. It's also the same handle for her Instagram and for her Facebook if you would like to connect with her. And you can also read her story on blackdoctor.org for some information about how she received her diagnosis, how she went through her very first clinical trial for MG, and basically how to understand the illness better. And please be sure to check back with us next month for our next clinical trials interview and chat. So if you have anyone else that you'd like us to talk to, please let us know. And you all have a lovely day.